Femoroacetabular impingement is a condition of the hip which causes pain and limited movement. It's due to an abnormality in the shape of the hip, which can either be something on the thigh bone or on the hip socket. We know that it's a condition that's only been recognised fairly recently, and it can present in any age from adolescence all the way through to later adulthood. What happens is that because of an abnormality of the shape of the hip, as the hip moves, it causes pain, which is the impingement, and this repeated impingement can lead to damage to the cartilage and the soft tissue structures such as the labrum within the hip. And we know that eventually this can lead to arthritis in the hip and early wear and tear, requiring potentially a joint replacement. The symptoms of femoroacetabular impingement include pain and limited movement. Some people will complain of pain when they flex the hip, such as when sat in a chair, when they twist the hip, such as doing sports or getting in and out of the car, and sometimes they'll have pain at rest. They may also have clicking and a feeling of instability in the hip. The pain can be felt in a variety of locations. People will describe this felt in the groin, on the outside of the hip, the back of the hip, or deep between the legs in the groin region. The symptoms can be mild. They may just occur with certain occasions or extreme sports. They can be intermittent, or they can be severe and progressive over time. If the hip becomes arthritic, then the symptoms tend to become more prolonged, more severe. For example, can cause pain in bed at night. People also notice some limitation of movement, and they may notice that difficulty bending, twisting, doing sports. There's a range of treatments once the diagnosis has been made. It depends also on the results of investigations such as x-rays and scans to look at the shape of the hip and the shape of the cartilage within the hip joint. A treatment can be quite simple, from giving advice about modifying activities, positioning, changing seating positions, changing the way we sit in a car and getting out of the car. Physiotherapy has a role to play with femoroacetabular impingement, and there was a recent national study called the Fashion Trial, which showed that physiotherapy has a beneficial effect on femoroacetabular impingement. If symptoms don't settle with this method or with simple painkillers, then there are surgical options, and these are varied and they depend upon your individual condition and your needs and the state and shape of your hip. Broadly speaking, surgery can involve an open operation in the groin to remove any bumps of bone that are catching. It can be arthroscopic or keyhole surgery, or it can involve bigger surgery known as a surgical dislocation of the hip, and even other forms of surgery to divide the thigh bone, rotated around and fixed in place, which is known as an osteotomy. And if femoroacetabular impingement does lead to arthritis of the hip, then sometimes the best surgical option is in fact a total hip replacement. The recovery from surgery depends very much on what type of surgery you had and any other medical conditions that you might suffer from as well. So it is quite variable. In general, after open surgery through the groin or keyhole surgery, you would expect the patient to be in hospital maybe 1 day, 1 night. They would need to use crutches afterwards, so this time can vary between a few days to a few weeks depending on the amount of surgery that's been undertaken. We'd expect the patient to be able to weight bear with crutches during that time, and then gradually increase the level of activity over the next few weeks. In terms of returning to work, on average, we'd expect someone to get back to an office type job within 4 to 6 weeks, and a manual job may take up to 3 months. And with physiotherapy and range of movement exercises, recovery can take somewhere between 3 to 6 months to get a full appreciation after that type of surgery. With a bigger open surgery, where we dislocate the hip, this is a bigger operation and the recovery can be longer. We'd expect 1 or maybe 2 nights in hospital. We'd need to use crutches for approximately 6 weeks afterwards. We'd need a follow-up check x-ray to make sure that everything's healing okay, and return to office work again somewhere in the order of 6 to 8 weeks, and to manual work 3 to 4 months depending on your recovery. This can be advice on lifestyle, modifications to the home and working place, simple painkillers, and maybe more complex or stronger painkillers depending on the level of symptoms. We can sometimes consider a steroid injection into the hip joint, and this can be useful just to settle down symptoms for a short period of time. It can also be used to help diagnose where the pain is coming from. There can be several sources of pain around the hip which aren't all necessarily due to femoroacetabular impingement. Physiotherapy has a role to play. Physiotherapy has been shown in a trial, a fashion trial, to improve symptoms of femoroacetabular impingement. While it doesn't make the condition go away, it's useful to improve strength and confidence around the hip. And also, a physiotherapist can advise on methods of protecting the hip and avoiding getting into positions where femoroacetabular impingement works.